Bloodborne pathogens. Now you're saying, why the heck do I need to know anything about bloodborne pathogens? You need to know because sometimes someone gets a cut and there is the potential, although very small, that you could come in contact with someone else's blood. If there is blood, you need to know how to protect yourself and how it could affect you. That's why you need to know about bloodborne pathogens. Pathogens are microorganisms, viruses and bacteria, microscopic organisms that can give you a disease. Bloodborne means you'll find them in blood, semen, and other fluids. The three most common bloodborne pathogens are human immunodeficiency virus, or HIV, hepatitis B, or hepatitis C. All of them can have long-term effects, and that's one big reason for you to protect yourself from getting infected. Now, the first thing you should know is bloodborne pathogens are not transmitted by casual contact, like if you touch someone or share equipment or work in the same place. Even if you do get someone's infected blood or body fluids on your skin, it doesn't necessarily mean you're infected. The infected blood or body fluids have to get inside your body. How does it do that? 3 ways. Through mucous membranes, like your eyes, nose, and mouth. Through cuts, sores, rashes, or even dry, cracked skin. Or through a puncture wound, like when a needle or broken glass is contaminated with blood. Contaminated means there's a presence or reasonable presence of blood or infectious materials. There are 3 ways to protect yourself. Be aware, use personal protective equipment, and be smart at work. To be aware, you need to follow a concept called universal precautions. This means you always assume all human blood and body fluids are infectious. When there's an injury and body fluids are present, ask yourself, is it wet and is it mine? If it's wet and it's not yours, follow universal precautions and use your personal protective equipment, like single-use gloves, so you keep potentially infectious fluids off of you. If you use gloves and they get contaminated, you remove them by turning them inside out. Put them in designated containers to be discarded or decontaminated. If you touched blood or body fluids or got some on your skin, you need to wash that area to prevent infection. Put your hands or other contaminated areas under warm running water. Work up a good lather with the soap and scrub the area. That abrasive action will get rid of any contaminants. Rinse well under warm running water. And dry your hands with a clean towel. If you don't have any water, use a waterless disinfectant hand cleaner. But as soon as you can, be sure to wash your hands and exposed skin. If you get any body fluids on cuts, sores, or cracked skin, immediately flood it with water. Then wash it with soap and water. After you wash it, you're not done. You're going to want to tell your supervisor or employer and get medical attention. Hopefully, you will never have to deal with a coworker who gets injured, but if you do your best to get help and protect yourself from bloodborne pathogens.